In the series of videos that we have been making about the grades of baldness, today we are going to talk about the grade 5, Norwood grade 5 male pattern baldness. Hi, I'm Dr. Mayank. I'm a board certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery and the founder of Crown. Today we are going to talk about the Norwood grade 5. So when we look at a Norwood grade 5, you would see the recession of this frontal area going extensively much behind the level of your ears, just like something which was more than a grade 4A, which we had discussed about in the previous video. If you have not checked it out, you can find the link of that down below, and please do have a look. In grade 5, you have a thin rim of thinning of follicles which may be present in between the front and the mid as well as the crown area. This rim is something which is just keeping it from a grade 5A or a grade 6 male pattern baldness. In a grade 5A, you would see this island of hair that was the connecting rim in between disappear, and this entire area is something which is going to have thinning of follicles. It will not be something where you will have a clean area with no follicles present there. So if you fall in a grade 5 or a grade 5A, do stay with us throughout this video because we are going to show you some beautiful results that we have given to our patients with the similar kind of a grade. So this is a gentleman who was in his late 30s with the recession of his front, mid and crown areas as a Norwood grade 5A, along with the temporal triangular recession as well, where we have created and implanted the follicles onto this entire area, including his crown, over 2 stages. It is not a single session result. We have done it over 2 stages. First, we had covered the front and the mid, and then we planned for the temporal triangles along with the crown coverage, which has given him the kind of fullness that you're looking at. You can see that the hairline has not been created as a flat or a low looking hairline. As I mentioned in all my previous videos, I love creating natural looking hairlines which look conservative, which cannot be identified as transplanted hairline. The beauty of this is that the single follicles are placed in such an irregular manner that even people at your salon who have been cutting your hair may not be in a position to identify that this is something which has been created as a hair transplant. So again, you look at the other side as well, beautifully meeting hairline into the frontotemporal junction and merging with the left side temporal triangle. So this is something which cannot be identified that has been transplanted. But again, if you are at a young age and you're going with this kind of a coverage with temporal triangles and crown areas to be covered and you're under 40 years of age, then be very sure that you use medications to prevent the further expansion of baldness. It becomes extremely imperative. If you don't use it, then over a period of time, you will see thinning even in this area. People sell taglines to you that hair transplanted results are permanent. What we need to understand is that the transplanted hair which we take from the donor area in the back are also subject to the aging changes that are happening. Even if we choose to take the follicles just out of the safe donor area, which is not going to get engulfed by the male pattern baldness, then also over a period of years, you will see some amount of thinning of the density in the transplant. What we need to do for that is to use medication so that the progression of the hair loss doesn't become very rapid and you are in a position to enjoy these results for years to come. We have had patients of this kind of a stable age and grade of baldness who have been enjoying the results with the kind of magical transformations that we have created for over a decade as well. But it is your responsibility to discuss with your surgeon and then follow the medications as they have been advised. We're looking at the top view of the same gentleman where we have covered the front to the crown completely. You can see that there is some amount of thinning which is still there. So obviously the natural whirl of the crown from where the hair rotate sometimes may see some gaps because there are single follicles which we create over there, but rest of the area looks thick. Another gentleman with a grade 5 male pattern baldness with some amount of hair throughout this area. We have covered the front and the mid of the same gentleman, again making the hairline conservatively and making it look natural, merging with his lateral part. So this temporal triangle has also been created, which has kind of merged with the original hair what he had. On the other side, if you look at this, then obviously a natural looking hairline which has been created in an irregular manner, merging with the opposite side's temple. Another gentleman who's at a 54 years of age, obviously at a grade 5, we have created the hairline with the frontal coverage. We have not done anything to the temporal triangles. It is exactly the way it is. So we've not made it look very aggressive as per the age where he was, and have covered up the entire area. Another gentleman with a similar grade of a grade 5A, but obviously with some interspersed diffused thinning which was there. The patient was on medications for a long period of time, but was not seeing the kind of results that would have been expected out of them. So this transformation has been with one hair transplant of around a 4,500 odd follicles which we had done for him. Again, you can see from the side view as well that the hairline created is very natural and obviously merging with the native hair of the parietal humps that he had, covering the entire area with a beautiful density. But again, now when we do a hair transplant for such patients who are at the age group of 30 to 35 with diffuse pattern thinning in between, these hair are also something that we want to sustain post surgery. So if we don't use medications and you have a thinning of the hair transplanted hair over a period of time and you continue losing these hair as well, you will have the entire area again look thin out. That is the reason why people talk about hair transplant failures and disasters, where people say it doesn't work. Be very sure that you have a transparent discussion with your plastic surgeon, and they should be telling you the reality of what is going to happen as a progression based upon what is the kind of reference point which runs in your family. If there is someone who has extensive grades of baldness like a grade 6 or 7 with this gentleman at around a 30-32, then over a period of time both the side of the parietal humps is going to come down, the crown is going to expand further, and obviously he will lose the interspersed hair which were already there before the transplant. So now if we don't use medicines for this gentleman, over a period of time, maybe in the next 4 to 5 years, you will see that amount of thinning that you may have to jump in for another transplant. So anyone who's in the age group of 30 to 35 should be looking at least a 2 hair transplant over a period of time, which is done if you have been disciplined with medicines. If you don't take medicines, you may require multiple sessions over a period of years, which will not make it a fruitful experience. So always discuss thoroughly with your surgeon and make it sure that you comply by whatever are the kind of instructions that are going to be given to you. I hope you like this video, and if you feel that you are at a Norwood grade 5 and you would want us to help you out, please contact us at the numbers given below. If you have liked this video, please give us a thumbs up and also subscribe to the channel for similar kind of an educative content. This is Dr. Mayank signing off. Thank you.